Hi everybody, Justin the Diabetic here. So today I want to talk about Diabetes 101, kind of break down what is diabetes, the difference between type 1 and type 2 diabetes, and then some basic terms for diabetes and diabetes management. So what is diabetes? Diabetes is a disease which your blood glucose or blood sugar levels are too high. It comes from foods you eat. Insulin is a hormone that helps glucose get into your cells and give them energy. In type 1 diabetes, your body doesn't make much insulin. Type 1 diabetics are often insulin dependent. Type 1 typically means their pancreas doesn't function. There is a term called honeymoon phase, which is when someone's first diagnosed, their pancreas is still producing a little insulin, but eventually it does stop. Type 2 diabetes is often regulated by the individual's diet. They could take some insulin, they could take other medications, pills, some other different types of things, but most of the time their pancreas is still producing some insulin, just not enough for their daily needs. Then basic terms for diabetes. If you're on an insulin pump, you'll hear these two words a lot, basal and bolus. A basal is the base insulin. So that's the insulin that your pump is going to give you every hour. That insulin level can change depending on the user's needs, but the way it's set up, like on a schedule, every day at that particular time, a specific amount of insulin will be delivered. When a person eats or their blood sugar is high and they need to correct that, they'll provide a bolus. That is an extra amount of insulin that is given to help bring the blood sugar down to the desired level. Obviously, an insulin pump is what is used for those. The insulin pump has a cartridge that holds the insulin, often referred to as a reservoir. Different insulin pumps have different sizes, and the one that I use holds 300 units of insulin. So typically I fill it about every 2 days or every 2.5 days. Just kind of depends on my eating habits for that period. The reservoir is connected to what's called an infusion set. That is the tube that connects the insulin pump to your body. The infusion set has a small needle with a little rubber cannula on it, and you'll insert that and change those out, typically when you change your reservoir about every 3 days. And it has a clip on it. I will attach a video in it, a little clip to show you, but the clip is removable, so that way you can put a place keeper on it to seal it for you to take showers or swim or anything of that nature. And then the third part, if you have a pump and a CGM, would be the sensor. The sensor is inserted. My Medtronic one, I wear it for 7 days, and then it has a transmitter that looks like a little seashell that attaches onto the back of it, and that sends the signal from the sensor to my pump, and then my pump analyzes the data and displays what my blood glucose is. Everybody's insulin needs are different. There's a baseline, how you can calculate what your basals and your boluses, how that needs to be set up. Your bolus is often calculated based on a carb ratio. So for example, if you look at the back of a granola bar and it says that this granola bar has 15 grams of carbs, then your pump has a programmed carb ratio. So that way when you enter that 15 grams of carbs, it will tell you how many units of insulin you need. For example, mine is currently set at 5 grams of carbs per unit of insulin. So if I were to program that 15 grams of carb into my pump is going to calculate that I need 3 units of insulin. If my blood sugar is high and I put in that 15 grams of carbs, I might get a little more than 3 units of insulin, because the pump is going to calculate how to get me back down to my target blood sugar, which it currently is set as 120. So off of pumps a little bit, if you're just taking insulin injections, you could get insulin for 2 different methods. One, you can get a vial of insulin, and then you would take your syringe and measure out how much insulin you need and then take an injection. Or 2, you could have an insulin pen, which is a pen. It's a little larger than like a highlighter, and it has a dial on the end of it, and you twist how much insulin you need, put the tip on, give yourself the injection, and then push, and it'll give you that set amount of insulin that you programmed in the pen. Other different types of diabetes control, like medications and stuff, will be prescribed by your doctor. Often you'll take those medications in certain increments. It could be a day, it could be every couple days. That just kind of depends. When it comes to insulin, there are several different types of insulin. Most commonly is a fast acting and a long acting. So the fast acting is going to act between 1 and 4 hours, and then the long acting is going to be more like 4 to 8. So if you mix the two, you'll have a certain amount of fast acting to work for the first couple of hours, and then the long acting insulin will take over and work for the rest of the time. And then typically you'll take another injection. Like I said in my introduction video, I did take injections for a year, and that's the way it worked for me. I would take my morning injection and then my nighttime injection before dinner, and that was how I went through the day before I switched over to an insulin pump.